What if I told you that the power or the outcome of your health, I mean, how long you live, how soon you get sick, how often you get sick, and how risky or how complicated your illness can be is actually in your hands. Isn't that just mind blowing? As far as I'm concerned, that's what it is. And that's where lifestyle medicine comes in. You see, most people don't wake up one morning just out of nowhere and just decide to be unhealthy. This is what I've seen happens a few times. They start by maybe waking up tired, maybe they're stressed out, and they start to feel disconnected, to their reality or disconnected to everything. And you see them just trying to hustle and survive another week. And slowly, ever so slowly, the blood pressure starts to creep up. Your weight becomes harder to lose. And then for people, they start struggling with their sleep becomes fragmented. And then things like anxiety or depression, these mood symptoms start to become normal for them. And then they start to need medications and medications pile up. And at some point, you see them start asking the wrong question, like, hey, doc, what medication do I need? Instead of asking the right questions, which is like, what in my life, they want to know what in my life is slowly breaking me down. And you know what, guys? For me, you see that rift in that, it just makes me realize how much we have been disconnected with the reality of the impact of our lifestyle on our health. And that's where lifestyle medicine comes into play. You see, lifestyle medicine, it's not just a trend. And I'm so glad that it's starting to gain a lot of popularity. And when we say lifestyle medicine, you know that it's not just a diet. We're not just talking about yoga or green smoothies or maybe some Instagram page that is just wellness Instagram influencers. When we're talking about lifestyle medicine, we are emphasizing evidence-based branch of medicine that really focuses on treating, preventing, and addressing the daily habits that will eventually drive disease to different people in the first place. And according to the American College of Lifestyle medicine targets the root cause of conditions. And over the years in my practice, I'm so glad that I can be able to talk about the root causes of diseases like type 2 diabetes, high blood pressure, high cholesterol, heart disease, obesity, even certain kind of cancers. It's such a pleasure to be able to discuss the possibility of root causes with even mood disorders like depression and anxiety. So I want to kind of give a kind of like a key separation or key distinction to state this very clearly. Lifestyle medicine does not compete with medications because clearly it's evidence based and we understand constantly the role of medication. But we are asking, or it asks whether is the medication always the first or only answer? And many times when you come to my clinic, you hear me ask these questions, not because I don't want to put people on medications, but to make sure that this is the right route that we're following. And I've seen this, and there's an uncomfortable conversation, uncomfortable truth that comes with it, and it comes straight from decades of public health data that I'm about to share with you, and it shows that over 80% of chronic diseases are really driven by our lifestyle choices, and I'm talking about what we're eating, how much we're moving our body, or even if we move our body, how we sleep, how we cope with stress, and whether we feel connected or we feel isolated, and how much of harmful substances that we consume. I'm talking about things like alcohol or even cigarettes and other recreational substances. Modern medicine, and for me as a medical doctor, as a physician, a family physician, I've seen that modern medicine is incredible at emergency care. And I'm talking about acute care. But you see, chronic diseases, we're good. It's good. But at the end of the day, I found that there is better control of chronic disease when we prevent it altogether. And because chronic diseases are largely driven outside the hospital walls or in the clinic room, right? It's in your kitchen, your bedroom, your offices, your workplaces, the relationships that you keep with people, your routines. And the truth is that there's no prescription that can fully undo the impact of lifestyle constantly overwhelming the body. There is no prescription. Traditional healthcare as we know it, it likes to wait. It likes to wait for disease to appear. and then it will react and treat. And for the most part, it works. Certain times it works. But when we talk lifestyle medicine, it's asking a different question. It is asked, what have we what if we intervene early? How can we prevent this? What if we supported the body earlier? So we try to understand biology, and fortunately, science understands our human biology, understands the impact of our lifestyle on our health outcomes. So your body literally responds to what you're doing. So many times, most diseases, they're not dramatic. It doesn't happen overnight. It's always like a accumulation of activities and behaviors and like those small repeated daily habits that eventually will kind of grow and multiply into serious problems. So let me tell you a little bit about what lifestyle medicine just summarizes, right? It's usually founded on six foundational pillars. And I will keep talking about them as we go in this series. The first pillar is nutrition. We're not talking about dieting or expensive supplements or imported beverages. No. When we say nutrition, we're talking about your eating patterns and the quality and quantity of the food that you're eating, in the sense that what are you really eating and how it induces or reduces inflammation, things that stabilize your blood sugar, help your bowel, reduce risk of cancer, things that are good for your gut and your brain. So by that, we're constantly referring to minimally processed food, whole foods, plant forward diet, and these have been shown to prevent and even reverse chronic diseases. The second pillar is physical activity. As we know and we've heard, movement is medicine and should be prescribed as such. And when we say movement, I know some people might consider it to be like torture or punishment, but it's not to torture you. It's not some kind of aesthetics or some, expensive gym or Pilates membership. I mean, those could be okay every once in a while, but the real movement I'm talking about is the regular movement that you do, regular movement, which overall helps to improve your blood sugar, right? Normalizes your insulin, kind of like keep your insulin sensitivity normal, helps your mood, regulates your blood pressure, improves your sleep quality, and even optimizes your immune function. And as you can see, I didn't talk about weight loss because it's independent of weight loss, which is also important, but because your body was designed to move. You see, this new stillness, this new sitting in one place that we're doing, it's obviously been made worse by over dependence on things like television or screen, transportation, technology. And with that, clearly, disease always follows. The third pillar that I want to talk about today is sleep. Sleep. You see that I'm talking about that, not just a small power nap, but I'm talking about that restful, refreshing, for the most part uninterrupted, adequate sleep. Sleep is not optional, and I know sleep is one of those things that starts to suffer when people are going through different phases of life. Sleep is when your body repairs itself, and when you don't sleep enough, it disrupts your hormones, that regulate things like your stress, your hunger, your immunity, your mental health. So there's no supplement that can replace it, not melatonin, nothing that can replace adequate sleep, and no degree of motivation can override the impacts of poor sleep. Now, the next pillar that I want to talk about is the fourth pillar here, which is stress management. And you see, stress management, of course, in recent times, it feels like everybody is stressed. And the more we have technology that is supposed to make things easy for us, I find that we are almost working twice as hard to serve that technology. And many of us are stressed. You see, stress itself is not the problem, right? Acute stress is considered normal. Acute stress is physiological. It's good. It helps your body to act and react. But you see that chronic unrelieved stress, that is the one we're wary of, because that chronic stress, it keeps your nervous system on constant overdrive, causing inflammation, blood sugar, that feeling of burnout, brain fog. But when we come to lifestyle medicine, we're not saying we'll remove stress because that's widely unrealistic. We're trying to see how we can rebuild our life, rebuild it, kind of like add recovery, adequate recovery into that stress. And then the fifth pillar I'll talk about is social connection. You see, humans are not designed to be alone. No man is an island. Humans are social creatures. That's how it's supposed to be. But you see, loneliness in a world that is filled with so many people and we're all socially connected. It's very funny and interesting how we're still feeling very lonely and very isolated. And the truth is that loneliness increases your risk of death. That's your mortality risk. And it's almost equivalent with smoking. And when I say making social connections, I'm not talking about those toxic, dangerous relationships because those are equally harmful. Human beings, like I said, are wired for close connection. That isolation, it's heavy on the heart and it can cause a lot of heart problems overall. So building a good community and good network of people, of your team and everything, community is literally medicine. And the sixth and last pillar that I'll be talking about that lifestyle medicine is hinged upon is avoidance of risky substances. Now, by risky substances, and I'm also going to add risky substances and behaviors. I'm talking about tobacco, excess alcohol, and these days, any alcohol at all, other harmful coping mechanisms, poor relationships that you know are detrimental to your health. Many of these, of course, will start as a form of relief, or you don't see it as a reckless behavior, but over time it begins to turn to poison, and this can harm you, and they start to control you. So once again, in lifestyle medicine, as much as we advocate for you to minimize these things, we know how difficult it can be to do so. So we always advocate for making healthy swaps. That way it's easier for you to manage. So once again, I want to be clear. Lifestyle medicine is not anti-medication. Absolutely not. Lifestyle medicine is not anti-doctors. Lifestyle medicine is not anti-science. Lifestyle medicine is actually evidence-based medicine. I think it's medicine in one of its purest forms, where we're talking about pro-prevention, pro-patient autonomy and patient education, patient empowerment, pro health prevention, and pro long term health. And as a family physician, I still constantly prescribe medications when I know that it is absolutely necessary. But I also ask the question, before we start that medication and while we're on that medication, what can we change? Or even before we stop the medication, I always ask the question, what can we change in your lifestyle so that you need less medicine or no more medicine? Or, when we stop this medication, this is not going to cause you problem. For me, that is good medicine. And that is the medicine that I've been waiting for ever since I started my training. And the most empowering part of lifestyle medicine is, and I think this is something is to remind people that yes, there is the non-modifiable risk factor like your genetics. But these genetics, as I always say, it loads the gun, but your lifestyle, it pulls the trigger. And that means that even small changes in your lifestyle, it matters. It really, really matters. And once again, lifestyle medicine is not about what you see with these Instagram influencers or podcasters talking here or there about things that they feel like saying or based off of very poor evidence. So this month, I'm really just trying to introduce the world to lifestyle medicine, those that have never heard about it, just to get you to become more curious about lifestyle medicine, right? Curious enough to want to take more responsibility for your health, because the power is in your hands, and anything that most doctors or healthcare providers will offer you is almost always plan B or like a safety netting. But your lifestyle and your choices is literally in your hands for the most part. And it's not about irrespective of even your genetics. Personally, I've seen patients able to reverse, and I'm not saying control or manage with medications, reverse their diseases with lifestyle medicine alone. So isn't that wonderful? Personally, as a clinician, I think it is fantastic. So I just want you to beg for that curiosity. I want you to lean into that curiosity and decide to do something and consistently about your health. For me, I think that is where the real health begins. And this is indeed a treasure. Thank you for joining me today, and I'll talk to you next time.